In humans, the mandible is the largest, strongest, and lowest of the facial bones. The mandible is also called the lower jawbone because it forms the lower portion of the jaw. The mandible consists of 12 different structures that help form the entire lower jaw. On the inferior posterior portion of the mandible up to the superior posterior portion are the mandibular condyle, mandibular notch, and coronoid process. The function of the mandibular condyle contributes to the rotation of the head, while the mandibular notch allows the passage of the mesenteric nerve and mesenteric artery and vein. The coronoid process allows for attachment of the temporal muscle. Continuing with the ramus of the mandible, the angle of the mandible, and the mandibular foramen. The ramus serves as a bridge to the temporomandibular joint, which allows for the closing and opening of the mouth. The angle of the mandible allows for muscle attachment, while the mental foramen allow for passage of certain vessels and nerves. Continuing up to the anterior portion of the mandible is the body and the mental foramen. The mental foramen allow for passage of the nerves and other veins which supply tissue to the mouth. In the center of the mandible are the mandibular symphysis and mental protuberance. Lastly, inferior to the body of the mandible are the alveolar processes and margin, which run along the teeth. On the posterior portion of the mandible is the mandibular condyles. The mandibular condyles articulate with the mandibular process of the temporal bone, which form the temporomandibular joint, which helps with mastication or chewing. In between the mandibular condyle and coronoid process is the mandibular notch. The mandibular notch is a thin portion of the mandible that forms the upper border of the ramus. The mandibular condyle is located anterior to the coronoid process, which also forms part of the inferior border of the ramus. Next, the ramus and the mandibular angle can be seen. The inferior border of the ramus is thick and straight, while the superior border is much thinner. Joining with the coronoid process and the mandibular condyle at the superior end of the bone. The angle of the mandible is found directly below the mandibular condyle on the posterior portion of the ramus. On the deep surface of the mandible, behind the ramus, are the mandibular foramen, which allow for mandibular vessels and nerves to pass through. Following the ramus of the mandible, angle of the mandible, and mandibular foramen is the body of the mandible, which is somewhat horseshoe in appearance. Along the anterior surface of the mandible are the mental foramina, which allow for mental nerves and vessels to pass through. In the center of the mandible is the mandibular symphysis. This is a junction of the two bones that were formed during the early stages of life. This faint ridge also divides the mental protuberance. This is a triangular prominence on the anterior surface where the two sides of the mandible come together. The alveolar process is found along the superior portion of the mandible. The process holds the two sockets along the bone that hold the teeth together. The alveolar margin, or alveolar ridge, is a small protuberance just behind the right front teeth that can be felt with the tongue. The alveolar process is along the teeth, while the alveolar margin is the socket between each tooth. The four major muscles involved with mastication or chewing are the masseter, temporalis, and medial and lateral pterygoid muscles. The masseter muscle is primarily involved with chewing, while the temporalis muscle assists with the closing of the mouth, grinding of the teeth, and moving the mouth from side to side. The lateral and medial pterygoid muscles assist with chewing, jaw rotation, side-to-side movement of the mouth, and projection of the lower jaw. All structures of the mandible help with all functions. Along with the maxilla bone and the mandible and maxilla form the mouth. Without the help of the mandible and the articulating muscles, we would not be able to chew our food or talk.